There's been models like this in terms of sobering centers, but this is really a collective push forward from what's been done in different jurisdictions.
A Toronto hospital has opened a standalone clinic where paramedics can drop off people experiencing homelessness and are intoxicated in order to help with their recovery.
If EMS is called, they're taken to the emergency department, where a wait to get to a bed can take 5 to 6 to 7 hours, where that same really valuable paramedic team cannot be back out on the road, has to wait with the patient until there is a bed, when there's really no acute medical issue that needs to be screened. And so for far too many people, when they're dealing with alcohol intoxication, the choices are the hospital system or the prison system in terms of the calls that are made.
The University Health Network and several partners, including Toronto Paramedics and the Neighborhood Group, have launched the Stabilization and Connection Center, which is near Toronto Western Hospital.
A direct route for people who have alcohol intoxication. Again, we see a variety of spots and places that they can come into the center, and they get dropped off where they're cared for by peer workers, community workers, harm reduction workers, and there's clinical oversight with a physician on call to ensure that they're recovering well. And before they're discharged or leaving, they're able to be connected with different supports out in community, ensuring that they're getting other healthcare access.
The Stabilization and Connection Center runs 24 hours. It has a strict policy of seeing only people with alcohol intoxication and no signs of drug use, normal vital signs and blood sugar levels, and no recent trauma and no complicating medical factors. CityNews has been told that this launch has been successful so far, as they have seen more than 24 patients, and that there have been improvements in ambulance offload times and beds are being freed at the hospital's emergency department. In Toronto, I'm Brandon Rowe for City News.